Cinnamon's a spice that's been loved for its flavor and potential health benefits for centuries. It's also been heavily hyped for its potential uses, specifically for diabetes and obesity. But what does the research say about it? And what can you realistically expect from taking cinnamon supplements or tea? Well, it might depend on the type of cinnamon you're talking about. Cinnamon is a spice that comes from the inner bark of several species of trees. Depending on where the trees are grown, you might get a different type of cinnamon. The three most common types are Cassia, Ceylon, and Saigon. They're grown in different parts of the world and have different flavor profiles. Cassia cinnamon, also known as Chinese cinnamon, is the most widely available and least expensive variety sold in North America. It's grown in Southeast Asia, mostly China, and has your typical cinnamon flavor: strong, sweet, and pungent. Ceylon cinnamon, also known as true cinnamon, is native to Sri Lanka and southern India. It has a less strong, lighter, sweeter, and more delicate flavor, and is more expensive than Cassia cinnamon. Saigon cinnamon, also known as Vietnamese cinnamon, is considered to be the strongest and one of the most pungent varieties of cinnamon available. It has a dark reddish-brown color and strongly pungent, sweet, spicy flavor. It is grown in Vietnam, Indonesia, and southern China. The difference in their taste is due to the differences in the amounts of cinnamaldehyde and coumarin they contain. Cinnamaldehyde and coumarin are two of the most abundant compounds found in cinnamon. Ceylon cinnamon has the lowest concentrations of these compounds, which leads to their naturally lighter and more delicate flavor. Saigon cinnamon has the highest concentrations of these compounds, which creates the strongest cinnamon flavors. The differences in the amounts of these compounds also likely explains the slight differences in the therapeutic effects of the different cinnamons. Allow me to explain. The main way cinnamon is believed to help with diabetes or obesity is that cinnamaldehyde and coumarin both seem to help make our bodies a little more sensitive to insulin. Insulin helps our body to efficiently use sugar as fuel so that any sugar we do eat is quickly used by the cells in our body and doesn't stick around in the blood and cause problems or become stored as fat. They also have some potential anti-inflammatory and antioxidant effects and may help to reduce some of the inflammation and damage caused by diabetes or obesity. Research indicates that cinnamon has some potential in helping those with type 2 diabetes, specifically to help with managed blood sugar and cholesterol levels. Studies that look at cinnamon for managing diabetes are, firstly, mostly done with Cassia cinnamon, probably because it's the most widely available, but more interestingly, studies using Ceylon cinnamon don't seem to find it to be as useful as Cassia cinnamon for managing blood sugar in diabetics. While the studies for both cinnamons are mixed, meaning that there are studies that show both does or doesn't help with diabetes, there is a higher proportion of studies that suggest Ceylon cinnamon doesn't help. Cinnamaldehyde is a chemical with a number of potential health benefits, one of them being controlling blood sugar. It makes sense that a cinnamon that contains more cinnamaldehyde would potentially provide more benefit than one that provides less. So, culinary preferences aside, the research would suggest that if you are going to take cinnamon for diabetes, you should stick with Cassia cinnamon, since not only is there more research behind Cassia cinnamon, but it also provides more cinnamaldehyde and potentially more benefit. If we follow this rationale, Saigon cinnamon, since it contains even more cinnamaldehyde than Cassia cinnamon, should also be potentially more beneficial for diabetes, although we can't say for sure since there aren't actually any studies that use Saigon cinnamon. So cinnamon may have some small benefits for diabetes. But what about weight loss? The research again is not very clear and mostly mixed. The bulk of the research again uses Cassia cinnamon, and the average weight loss was quite underwhelming, anywhere from no weight loss at all to 1 to 2 pounds over a few months, with those who have diabetes or PCOS seeming to benefit more than others. So even if it does help, you may not even notice it. But another challenge for people who want to use cinnamon is the dose required to benefit from it. Most studies using raw cinnamon powder are using around 3 to 6 grams per day to achieve some sort of blood sugar benefits in diabetics. That's almost a teaspoon or two of pure cinnamon powder every day. And you thought the cinnamon challenge was bad. This is why supplements that use cinnamon rarely use enough of it to be useful, and adding cinnamon into their supplements ends up being mostly cosmetic. It's also why, for some people, taking cinnamon to help with diabetes or obesity is not realistically feasible. Because the amount of cinnamon you need to take is so high, some people try to incorporate it into their diet. This makes taking the recommended 3 to 6 grams per day a lot more feasible. Some people blend it into smoothies or use it in all types of cooking. Cinnamon tea is another popular way of taking cinnamon. Unfortunately, cinnamon tends to be used in a lot of sweet and dessert dishes, meaning if you're trying to get a lot of cinnamon into your diet and you're doing it by eating a lot of Cinnabons or cinnamon pastries, you're not doing your diabetes or weight loss any good. Cinnamon is relatively safe to take. However, sources frequently cite the potential increased risk of liver toxicity and even cancer from taking too much cinnamon, due almost entirely to the coumarins found in cinnamon. They're found in small amounts in a lot of vegetables, spices, fruits, and medicinal plants. However, they're really only found in high enough concentrations that we really care about in cinnamon, specifically Cassia or Ceylon cinnamon. Coumarins have some theoretical beneficial effects on the body, things like having anti-inflammatory or anti-cancer effects. However, at high doses, it has some theoretical negative effects like liver toxicity. Now, the cancer risks are mostly blown way out of proportion, and these effects have really only been shown in mice and rat models, not humans. Additionally, these studies use doses of coumarins that are ridiculously large. Studies in humans show that the risk of cancer from taking cinnamon is essentially negligible. However, the risk of liver toxicity, albeit rare, is something that has been shown in humans before. We have a few case studies of people consuming cinnamon supplements and developing liver injury. Granted, most of these cases were in people who were taking high doses of cinnamon in combination with other hepatotoxic medications like statins, or were at risk of liver injury in the first place. So the risk is exceedingly small if you're a healthy adult taking cinnamon supplements. However, because cinnamon is so often recommended for diabetics, and diabetics are often taking medications like statins and at a higher risk of liver issues like fatty liver disease, and that cinnamon likely requires a high dose for it to be helpful, I think that if you're a diabetic looking to take cinnamon for additional blood sugar support, you should go ask your doctor first. Although Cassia or Ceylon cinnamon do contain significant amounts of coumarins, Ceylon cinnamon has far less. This is the main reason why, despite the fact there is much more research behind Cassia cinnamon, and Cassia cinnamon is likely more effective than Ceylon cinnamon for diabetes, some sources exclusively recommend Ceylon cinnamon. It's also why supplements that contain significant amounts of cinnamon will use Ceylon cinnamon, and why supplements that don't contain much cinnamon are okay to use the other cheaper types. It's because Ceylon has much lower coumarin concentrations and is therefore safer to use. Not because it's somehow more effective because it's more expensive. It's actually less effective than other cinnamons, just safer to use. Keep in mind, the safety risk is really only an issue if you're taking large amounts of cinnamon. So if you're only taking around 1 to 2 grams a day, or even less, the risk is minimal. It's because of these reasons why taking cinnamon specifically for therapeutic use in diabetes and obesity can be challenging. Don't get me wrong, cinnamon is an amazing culinary spice, and cinnamon tea is also delicious. But when you look at it from a medical standpoint and combine the small potential benefit it provides with the large amounts of cinnamon you have to take every day, with the fact that the types of people you might actually recommend it to are at a higher risk of experiencing liver injury, you'll start to see why I often don't recommend cinnamon supplements to my diabetic patients, especially in the face of many other safer and more effective supplements for improving insulin sensitivity, like berberine or chromium. If you want to learn more about using berberine or chromium for diabetes or weight loss, check out those videos in the description. At the end of the day, the best type of cinnamon really depends on what you prioritize. Different levels of cinnamon contain different levels of cinnamaldehyde and coumarins. The varieties that contain the most cinnamaldehyde also tend to contain the most coumarins. While cinnamaldehyde contributes to the beneficial effects of cinnamon, the coumarins at high doses can potentially contribute to some of the negative effects, such as liver injury. So if you're perfectly healthy and want a more effective cinnamon, Cassia will give you the best bang for your buck. But if you have diabetes and are taking other medications, Ceylon will provide a safer alternative. As long as you maintain a moderate dose of around 1 to 2 grams a day, having any cinnamon shouldn't be a big problem for you. Hi, I'm Dr. Brian Young. Do you take cinnamon? Let me know about it in the comments down below. Subscribe and hit the notification bell to stay up to date. And if you found it informative, please leave me a like and share this video with someone you know who can use the info.